Well, thousands of Canadians are frustrated and scared because a drug they need for their cancer recovery is running dangerously low in supply.
And the pharmacist informed me that they had no tamoxifen. So of course I was shocked. It's terrifying to think about not taking it and what the consequences of that are.
Well, that was Wendy Ackerley. She's been taking tamoxifen for the past 2 years. It's primarily used to treat breast cancer and prevent reoccurrence. Joining us in studio this morning on what patients can do in the meantime is Dr. Lita Forbes. She's the provincial head of systemic treatment at Cancer Care Ontario. Welcome to your morning.
Thank you.
Health Canada says they are working to end this shortage, hopefully by the end of December or January 2020. If a patient has no tamoxifen left, what's the risk for them?
Well, that depends on each patient. Every patient has an individual risk depending on the type of cancer that they've had. And we would recommend that they speak to their healthcare professional about what the risks are of a temporary pause in their treatment or what alternatives there could be that they could be switched to in the interim.
If people are watching and not familiar with how tamoxifen works or what it does, what do they need it for as part of their recovery?
So we use tamoxifen in breast cancer. We use it in a few other less common cancers, but mostly breast cancer. And it's used to prevent recurrence after patients have had their surgery. It's also used to control disease in patients who have more widespread cancer.
Health Canada says it identified international supply. They are working to make it available to Canadian patients as soon as possible as a short-term measure to manage this supply gap. So what alternatives are there for patients if they find themselves without the drug?
So there are some other oral tablets that can be used, but they have to be used in patients who are past menopause. There's also some injections that can be used. Some patients may want to take an alternative. Some patients may want to pause taking their drug. But we understand that not taking a drug is very anxiety-provoking for patients, and that is not always the best alternative. So we would recommend they speak to their medical oncologist so that they understand what the risks and the benefits are.
How did Canada get into the position where, this is a drug that's administered right across the country? It is one of the most common for cancer care treatment, and it's used by patients for 5 to 10 years. How did we get in a position where there's just not enough drugs to go around?
Well, we have 3 suppliers of tamoxifen in Canada. 2 of them have identified manufacturing issues, and the third's not able to keep up with the rest of the demand.
So in the meantime, if patients are at home wondering, if they need this to stop recurrence, is there a risk that the cancer cells can regrow? Is there a risk that the cancer comes back because they've had this halt in their treatment?
Well, we're hoping that we minimize a halt in treatment for as many patients as possible. But for some patients who have a very low risk of recurrence, the risk of actually pausing the drug may be very, very small. But I would recommend before they actually pause the drug to speak to their healthcare professional about what the true risk is and understand what they could do instead.
Dr. Forbes, thanks for coming in this morning.
You're welcome.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.